An estimated 8,000 adults with autism here in New Jersey are on waiting lists for group homes. But the lists are years long, and in the meantime, many parents worry about what will happen when they're gone. NJN News health and medical correspondent Sarah Lee Kessler reports on this growing crisis here in New Jersey.
Antonio Leon and Michael Bindi, who are in their 40s, both have autism. They've been roommates for years and are among the 5 adults who live in this group home in Mercer County that's run by Eden Autism Services. These best friends are the lucky ones.
Eden has not opened a group home probably in the last 8 years or so. And the reason is, it's not because there's no homes. There are plenty of homes available. There's no funding available to provide the services within those homes.
That includes round-the-clock supervision, 7 days a week.
It's nightmarish thinking what would happen to him if I were not here, if something were to happen to me.
Kathy Moore's 34-year-old son, Kevin Petranek, has been on a waiting list for a group home for a decade.
Kevin is number 417 on a waiting list, which he's been on for 10 years.
How frustrating is this for you?
I'm beyond frustration. It's almost like being in a prison. You can't go on. I can't leave Lawrenceville, basically.
Despite Moore's tireless efforts to secure residential placement for her son, and she has the paperwork to prove it, Kevin still lives at home while working full-time at nearby Educational Testing Service in Princeton. It's the same story for Norm Greenberg. His 34-year-old son, Stephen, has been stuck at number 785 on a group home waiting list for 13 years. Meanwhile, Stephen works part-time at Wawa while living at home.
It's to a point where that he's on the waiting list is almost immaterial. The waiting list doesn't move.
Greenberg, who's 66, says he and Stephen's mother worry nonstop about their son's future.
We're horrified. We're frightened to death of what could happen if we go and he isn't appropriately cared for in a residential program. Well, I'm not only the parent of an autistic son, I'm a taxpayer, and I recognize the need for fiscal responsibility, but these people have to be cared for because they can't care for themselves.
Supervised residential placement makes all the difference. That's Antonio's bed?
Yeah.
And which one is yours?
The Superman one.
Why do you like Superman so much?
To save the world.
Sarah Lee Kessler, NJN News, West Windsor.